So that brings us right into migraine, and you'll recognize that person sitting back there. I use my wife for everything. She said, do a migraine, Debbie, and so we did, and I applied a little filter to it here to make it a little more anonymous. It does a pretty good migraine, probably. Abdominal migraine. Here's one of those readings. This is one of those readings toward the end of his life, the latter period, where I said he really gets right down to it. Boom, boom, boom. Here it is. And so you really find these kind of jewels in that latter group. And we find while the body is in the developing stages, the sources of the conditions to which the body becomes allergic in the digestive system should be looked for that deal with all migraine headaches. So that's one of those categorical statements. All. Eat 3 almonds a day, you'll never get cancer. All this, all that. When it's a categorical sort of thing. So the allergic reaction in the digestive system. And when you go back and look at the medical literature in 1912, there's a couple citations from 1912. In the majority of migraine patients, there is some fault in the gastroduodenal hepatic chain. That's the digestive system. The gastric is the stomach. The duodenal is the small intestine that comes right out of the stomach. And the hepatic chain. So that whole idea of the hepatic system and how it's interacting. And that's a medical doctor. This is a mainstream neurology text in 1912. This is not New Age. This is not alternative medicine. Mainstream medical perspective. And even looking down into the colon, here's another medical doctor. It's exceedingly probable that the saline stimulates elimination by the bowel. He's talking about colonics here, or colon cleansing. And it is not uncommon experience to find that a beginning migraine attack is frequently aborted by a saline taken as soon as prodromal symptoms are noted. And you can get an aura in migraine. Get an aura in epilepsy, you can get an aura in migraine. And very often it's a visual kind of phenomena. It's something that precedes the main part of the attack. And they're saying in the early stages here, using a saline, enema, saline, colon cleansing, can avert the attack. Isn't that interesting? And by the way, to back up to epilepsy for a moment, I found an article in an old Australian, it's part of the journal, sort of like the JAMA version in Australia a number of years back. There was an old time MD there wrote a letter to the editor and said, by the way, when you get people with these intractable seizures, particularly the ones that go on and on, if you give them an enema or a colonic irrigation, you'll almost always stop their seizure. During the seizure, just do that and it'll stop the seizure. He gave a number of cases where that was true. We had, as a synchronicity, at a recent conference here, in fact, just in September, A.R.E was giving a talk, and out of the blue, someone comes up after the talk and starts talking about how she worked in a rehabilitation program with people with various developmental disorders, and you get a fairly high level of seizures amongst those people, more so than the general population. And she said the first thing we would look at was say, are they constipated? And eliminate the constipation, get rid of the constipation, and they won't have the seizures, or they'll have less seizures or less severe seizures, just from the bowel. Interesting, isn't it? Okay, so migraine. So epilepsy, something that Cayce traced back to the intestinal tract, the digestive system, and he's saying the same thing with migraine. As I said, even if you come up into more modern literature, 1942, somewhat more recent, it's the duodenal stasis, or sort of sluggishness, can be related to the absorption of allergens. That's that auto-intoxication model we talked about earlier, where you absorb toxins from within the system. That reacts in this inherent pattern of migraine. Also, you get recurrent abdominal pain as an early expression of migraine, and strongly support a causal link between recurrent abdominal pain and migraine. That's in 1995. That was one of the articles we found on dietary migraine, abdominal migraine. There's a very big literature on that somehow something in the abdomen. Cayce said that allergic reaction in all cases of migraine is what he said. And you can find a lot in the literature on that type of process. And you do find the abdominal migraine, and you find it in children and adults when you look into the medical literature. These are mainstream medical citations. It's not like alternative medicine or whatever. It's mainstream. Here are some of the common gastrointestinal symptoms of migraine. Not so different than epilepsy. I mean, this is the kind of stuff you can get in that premonition, prodromal stage of epilepsy. Very common in migraine as well, to have this as either part of the migraine attack or in that aura or preceding the migraine to have these kind of symptoms. Now, in Cayce's time, the main model for what was causing migraine was a vasomotor model. You hear that? Vasomotor. We talked about the vasomotor this morning. There's something wrong with the circulation pattern. Think of it like blushing when you get that rush of blood to your head. Well, there's commonly what's called red migraine or white migraine. Red migraine when you get a flush of blood to the head. A white migraine when you don't get, when there's less, not enough, like an over reaction in the vasomotors, you don't get enough blood to the head. Two different types of migraine. So this is what we're talking about, the vasomotor or vascular model of migraine. That was the predominant model for many, many years. And more recently, what's being emphasized is what's called the neurologic model, and it's the trigeminal nerve. Remember I talked about the cranial nerves this morning? The trigeminal, the fifth nerve, is what you find. And you find the two melded together. So it's the trigeminal vascular model, or the vascular trigeminal model. That's the latest thing in terms of how do you explain what causes migraine. Let me hold on to that for a moment. What you find, if you go back to Byron Robinson, the abdominal pelvic brain, he has almost a whole chapter devoted to this trigeminal connection with the abdominal and pelvic brain. Now the vagus nerve, we talked about earlier, the wandering nerve that comes down into the abdomen, we know that. It's not so well documented, but Robinson says this trigeminal nerve that comes up and innervates the sides of the face like this, he says it has associations all the way down into the lower abdomen. So in case he's talking about how does this happen, maybe that's the association. But in a number of those readings, he says it's the fifth nerve, hence you have migraine. It's the fifth nerve, hence we have a migrainous condition or something of that nature. Cayce made that connection. He also made the vascular connection, that there's a rush of blood flow to the head. So he covered both those models in his migraine readings. I can show you readings explicitly. And he connected in all these abdominal symptoms as well. When they ask, why do I have nausea when I have these terrible sick headaches? Why do I have this and why do I have that? And he laid out the whole physiology of how it plays out through the system, beginning in the abdomen, usually. There are some of the treatments, and you can see why those would be helpful for people with migraine with this kind of abdominal pattern. Now, we did a little migraine study where we had 5 people that came here to a residential program, and 3 of the people reduced their symptoms significantly. 1 person didn't follow the treatment plan at all, and 1 person had brain injury. That was the woman I said that, it had the, or maybe I didn't say, but one of the ladies did have a brain injury, which may have caused her migraine. And that's pretty typical for a lot of our program. If we can get people to follow the protocol, they do pretty well. We get usually about 1/3 of the people would follow it pretty close when they go back home for the 6-month period. About 1/3 would do a little bit, but not the whole thing, and about 1/3 would never get started. And that's kind of what we saw with migraine. The people who stuck with it got excellent results. We had 1 lady we had 2 people virtually eliminate their migraines within a month or so, just by cutting out the foods, mostly those allergic foods. And 1 lady, and this was a hospital administrator, a really sharp lady, and having terrible migraines. And when she came back for the follow-up, she said, I eliminated my migraines with that diet. I know it was diet. I know what it is, but I couldn't stick with it. As miserable as I am with my migraine, when it came right down to it, I had to go eat the junk food for lunch or whatever it was. I couldn't eat the healthy diet. I couldn't eat the Cayce diet. You guys have got to find another way to simplify the diet, which we may have gone a little bit overboard. We were doing the full Cayce diet with 80-20 balance and all the things. And maybe what we could have done, there's some other studies here where they focused on certain food groups, and you systematically eliminate the food groups. It's a specific kind of elimination diet just for migraine, has a very high success rate when you eliminate certain food groups and on a trial and then add them back and see if the system reacts. So there's probably a way, and if we do this kind of study again, we'll probably try to use a slightly different approach to diet. But getting people to comply, that's the big challenge in all of our research programs. I wrote a paper on this and submitted and presented it at our symposium in the year 2000. So if you're interested in this aspect of migraine, this is a technical paper with all the citations and everything.